General treatment of chronic urethritis. General hygiene. Many of the general hygienic rules for the treatment of acute gonorrheal urethritis do not apply to the treatment of chronic inflammations. Thus, the diet, which should be light during the acute period of the disease, should be rather full and stimulating in the chronic stages. Exercise, which is always harmful in acute gonorrhea, is often beneficial to a chronic case. Exercise should not only be permitted, but should be encouraged. There is no reason to prohibit even such violent pastimes as tennis and swimming to a patient suffering from chronic urethritis. But they should be begun gradually, and the patient should feel his way, taking more and more exercise as he assures himself that it does him no harm. The intelligent use of alcohol is one of the most thoroughly misunderstood points about the treatment of chronic urethritis. Although we realize that many of the drugs and methods of local treatment employed for chronic urethritis are used chiefly because they are irritating, yet we forget that alcohol is one of the best known urethral irritants, and we are too much inclined to scoff at the story of the patient who, despairing of a cure after many months of treatment for his local urethritis, breaks training, enters a wild debauch, and comes out of it cured. Such a case is not the exception that proves the rule, but is only an illustration of the rule that what we seek for the cure of chronic urethritis is the proper irritant, and alcohol sometimes fits the case. Alcohol is almost universally harmful so long as gonococci can be found in the urethral pus, though there are rare exceptions even to this rule. But after the gonococci have disappeared, if the patient is a habitual drinker, it is proper to urge him to return gradually to the use of alcohol, and such a course frequently has a most beneficial effect, both upon the patient's mind and upon his catarrh. It is an exhibition of intelligence on the part of the physician to cure his patient by giving him whiskey to drink, rather than to run the risk of permitting the patient to make this experiment for himself. Other hygienic measures, such as sending a patient away from the city to the country, or bidding him change his climatic conditions by a trip at sea or to the mountains, are very rarely called for. Yet, when local measures fail after a thorough trial, it is imperative that the patient leave his work and his home to take a vacation. Under such conditions, a brief trip may well effect cure, or at least put the patient in such a condition that local treatment, which previously was ineffective, will now prove curative. Sexual hygiene. While gonococci persist, sexual intercourse is as likely to reinfect the gonorrheic as it is to infect his partner. But after their disappearance, it is likely to do good by relieving the sexual congestion of one who is, presumably, accustomed to frequent sexual intercourse. The irritation of ungratified sexual desire, the effort to check the sexual habit, is to many gonorrheics the most distressing feature of the disease. Drugs. Most cases of chronic urethritis may be treated successfully without any internal administration of drugs. Very exceptionally, a patient is benefited by the internal administration of balsamics or alkalis. More commonly, a brief, severe course of water drinking will cure a mild catarrh by flushing the canal. The alkaline mineral waters are, apparently, the best suited for this purpose. Urotropin is employed as an antiseptic preliminary to the use of sounds or dilators, and for the treatment of pyelonephritis or bacteriuria. Alcohol should be used intelligently, as stated above. Tonics may be required.